How have we all been? It's a pleasure to stand before you today. Thank you to the top management, to the organizers of this event. It's a pleasure always to stand before you. So tomorrow is the World Mental Health Day, and I thought it fitting to draw attention to our mental health by having a talk today being the day before that day. This day is important because it helps us to remember that apart from our physical well-being, we also have to take cognizance of our mental well-being. So what is mental health? What is this, buzz about mental health? Mental health is that state of mental well-being in which the individual realizes her own abilities, can cope with the normal stresses of life, and can work productively and fruitfully, and is able to make a contribution to his or her community. So the important thing about this definition is that being mentally well means you can cope with stress. It doesn't mean you don't have any stress. So, some people say, I'm in Nigeria, why won't I be mentally in balance? No, not so. All over the world, people are dealing with mental health problems, even the so-called developing countries or developed countries. So when you are mentally well, it means the stresses are there, but you realize your own abilities. The way you see yourself as able and competent to deal with those stresses, and also, to work productively in such a way that you contribute positively to your community. So that's the definition. That's what it means when we talk about mental health. So mental health encompasses how we feel emotionally, how we think, the thoughts we have about ourselves and other people, and our relationships. So it's not just about yourself. The reason why we're having this discussion at all is because it affects how we deal with other people. And the reason is that how we feel about ourselves and about the world affects our behavior. And our behavior is going to be, seen in the places of work, in our families, and everywhere we go. So that's how important mental health is. If anything that affects how you behave can affect, your place of work, your source of income, your relationship, that's something quite important that we should take cognizance of. So to the work of today, dealing with trauma. Why are we talking about trauma? Why this presentation? Why of all the topics did I think of talking about trauma? Well, it's because we are in Nigeria. We all know how our country is, how economic pressures here and there, the price of fuel. We could go on and on. We don't need to be reminded about the stresses in our country and how it's affecting us, every one of us. But more so also because this presentation actually was meant for a different group of people. Earlier this year, I was talking to Dr. Felix earlier, and I said this presentation was meant for a group of people that work with Doctors Without Borders, Médecins Sans Frontières in Zamfara. So their health maintenance organization, HMO, contacted me that they lost a colleague of theirs because of this herdsman and villagers clash in Zamfara. That I needed to talk to them to help them cope with how traumatizing that was to lose a colleague in the line of duty. And I prepared this presentation, and just before it was to hold, they called me and said, that can't hold, because on their way to the presentation, because they had to come from the nooks and crannies where there wasn't good network to gather in a place where there was better network, somebody else was attacked and killed. So the presentation never held. So in commemoration and to pay respect to the lost ones, the people who lost their lives in our own country, and to the thousands of people who have lost their lives in this country, could we please rise and have a minute of silence and silent prayers for those that we know, some of them we know, some of them we don't know, who have lost their lives since 2009. This country has been unstable. If we can offer silent prayers, that would be great. May the souls of the faithful departed, through the mercy of God, rest in peace. Amen. Thank you so much. All right. So those of us who are alive, the least we could do is learn how to deal with what is all around us, the trauma we see. Because there is such a thing as secondary and vicarious trauma. God forbid it may not happen to you, but being at the forefront as doctors, as healthcare providers, as relatives, as family members of loved ones, we see these things, we hear about these things, and it affects us. So that is what this presentation is all about. How can you handle this? Or perhaps you know someone who has been affected and you don't know what to do, you don't know what to say. That is what this presentation is all about. So this presentation, yes, there are prizes to be won in this presentation. I wanted it to be something different from what we're used to. So we're going to listen to this presentation, but I'd like you to listen with a difference today. So listen to adapt it to yourself, and as a healthcare provider, perhaps to your patients as well. I will be giving out 4 prizes to those who are able to answer questions at the end of this session. And the questions are purely from what I'm going to talk about today, so no trick questions at all. And this is also my way also to give back to DMC, because I know quite a few patients or staff would want to see me, but you know, even with the 50% discount, it's difficult to see me. So this is one way I can see you completely free of charge. Just listen to the presentation. So that's to show you how committed I am to make sure the environment I find myself benefits from the knowledge I have. So if you answer questions correctly, you will win either of these 4 prizes. The first is a skills training in mindfulness. Mindfulness is a technique to help you to be in the present, especially when you are anxious. It's also helpful when you find yourself not being able to concentrate or focus your mind because of anxiety or because of sadness. Assertive communication training is great for interpersonal relationships. When you have difficult conversations, especially between couples, you know, problems, you start off talking very nicely and then it goes up in a ball of flame and you're like, how can I get this person to get what I'm saying? Just understand, would you listen to me already? So that's assertive communication training. Emotion regulation training is a popular one. Almost, you know, like 50 to 60% of my patients at some point just say, look, I just want to know what to do with the way I'm feeling. I saw a patient who lost her fiancé 2 weeks to their wedding, and what she just wanted to know is, I am devastated, my chest hurts, my chest is heavy, I can't focus, I just want to know how to deal with this. So that is emotion regulation, especially overwhelming emotions. When it's not a pure emotion, it's not sadness, it's not anxiety, it's not anger, it's a mixture of all sorts of things, and the person feels like, look, this is not me, I can't deal with this. Anger management training is how to deal with anger, straightforward. So if any of these, you know, might be of interest to you, then you should probably pay attention to this presentation. Okay, so the purpose of this presentation is to educate all of us, to help us understand what happens when someone is traumatized, and also to reduce suffering of people who are traumatized here in one way or the other, and then to increase hope, sense of well-being by learning what to do. So that aspect of I don't know what to do, I've never felt this way where I'm helpless is removed, and that really reduces the suffering people face. So I'll use this outline. The picture I'm showing is just to draw attention to what is happening in our country today. It may not have ever affected you, thank God, but it's real what people are going through. The suffering and the insecurity is real. I was telling Dr. Felix earlier that just yesterday, in fact, I saw her this morning. HMO called, are you Sunshine Clinics? Yes. Oh, we're going to send a patient to you. Can you see her today? So I ended up seeing her today, and she entered one chance. Yeah, and she can't sleep, she can't eat, she's not able to focus. So her company was kind enough to give her some days off to see me to sort herself out. So these things are real, they are here with us. So I'll follow this outline. I'm at a time constraint. Dr. Felix has, I've told him to stop me in 20 minutes. I don't want to spend so much time in the preambles. I'm going to spend most of my time teaching the skills so that we don't rush that, because that's the point of this presentation. So what is trauma? Trauma. Everyone, I'm traumatized. What does it mean? So in the context of post-traumatic stress disorder, as medical people, if you're thinking your patient might have PTSD and you want to know whether the patient meets criteria, the DSM-5 criteria for PTSD, Trauma in that context means cognitive, emotional, physical, and relational response. The cognitive, emotional, physical, and relational response to experiencing or witnessing an event in which there is actual or threatened death, serious injury, or sexual violence. So there has to be that sense that I'm going to die, or you witnessed somebody dying, or you were sexually abused or witnessed sexual violence. And the trauma is such that it affects the way you think, how you feel, and you have physical symptoms. I mentioned the patient couldn't eat, she couldn't sleep. And then relational response, it affects your relationship with people you care about. Typically, people who meet criteria for PTSD describe a certain numbness where they know in their head that they care about this person, this is my child, this is my husband, but emotionally they feel nothing. So trauma affects the whole of you. If you've ever listened to me talk, you hear when I'm talking about, the biopsychosocial nature, that it's not only physical, it's psychological, your thoughts, your emotions, your behavior. So that is the definition of trauma according to DSM-5. However, trauma is beyond that. You don't necessarily have to witness a death or experience, feel like you're going to die for it to meet that criteria of being called trauma in another sense. So in this other sense, trauma is an emotional response to any event that is out of the ordinary, perceived as extremely stressful. And what extremely stressful means overwhelms your ability to cope. If you've ever listened to me talk about stress management, stress in itself means that response, that situation or feeling where what is happening is beyond your ability to cope. So that is what it means by extremely stressful. That is extremely beyond your ability to cope. All your reserves, your resilience, all you've learned in the past from your previous experiences does not prepare you to cope with that. That is the kind of event we're talking about. So typically it's a catastrophe. No precedence, it hasn't happened before, and our brains have a way of wanting to label things and put them in order, in files. So I have an interaction with so and so person, and he is lying, he is manipulative, so in my mind I'm like, okay, this person is not helpful, bad, or harmful. But in the case of trauma, what has not happened before is to such a degree that the mind doesn't have any precedence and doesn't know where to place it, doesn't know where to categorize it. Our minds like to file things a bit. So it is that sense of, what do I do with this? I don't know what to make of this. I've never experienced this before. I don't know how to respond to this. That is what we're talking about. So it's actually a kind of injury psychologically to the way you think, the way you see yourself, the way you feel, the way you relate to other people. Different things can be examples of trauma. Acts of terrorism, medical trauma, a procedure that was just, traumatizing. I'm looking for another word apart from trauma. Just, affected the patient so significantly. Natural disasters, sexual assault, bullying, accidents, the sudden loss of a loved one, unexpected, sudden, witnessing serious harm being done to a loved one, domestic violence, life-threatening illness, difficult childbirth. So all these things and many more, I'm sure you can think of a few more, is what we mean when we talk about trauma. And there are different types, regardless of the type of trauma. We call it acute when it's a single thing that has happened, like the patient I saw today, just once. It has never happened to her before. It's acute. It's chronic when it happens repeatedly, like someone who is repeatedly sexually abused, or like in relationship where the man who is meant to be a woman's protector is now the one who is bullying and beating and bashing and not only verbally abuses the person. So we say it's chronic, it's repeated on and off. And the importance of classifying the types is the effect it has on the individual is different. The more chronic the trauma is, and we'll talk about complex trauma in a bit, the more deleterious and severe the effect is on the person. Complex trauma is when you experience different types of trauma. So you might have been sexually abused and maybe physically abused. Not only different types of trauma happening repeatedly, but especially when the person traumatizing or the predator, the perpetrator, is someone who is in a position of authority, like a parent or a husband. So someone who ordinarily would be a source of comfort or nurturing is now the person perpetrating this act. Then it becomes more complex, like incest, or a case where I've had, unfortunately, I have seen patients who maybe parents would give them out to be sexually abused recurrently so that they wouldn't have to pay the rent, for instance. That is complex trauma. And especially when it happens in childhood, it's even more, severe, because childhood is the time when someone's sense of self is being formed. Imagine, when you, for the builders amongst us, when you want to build a house, you have cement. If you make an imprint in the cement at that time, it's difficult to get it off. It sets like that. So that is how the sense of self of children gets set abnormally. And then you have adults who grow up not really being able to differentiate what is sexual touch and what is not being able to differentiate what is a touch acceptable or a relationship that is right and what is wrong. Because at the time when they were supposed to be taught these things, and when these ideas of what is right, what is wrong, what is appropriate, what is not, was formed, that was when this trauma happened. So just to give you an idea of why it's important to know the types. Secondary trauma is when you are a witness, when it's happening right in front of you. You are safe, but you saw something happen that was traumatizing someone else. Vicarious trauma is when you are the caregiver. So people like medical people, therapists, first responders are also, at risk of being traumatized vicariously. So statistics, I'm not going to spend time. We all know this is our country, how insecure our country has been since 2000 with Boko Haram, farmer herdsmen, kidnapping, suicide. It's been terrible for a long, long time. So the thing about having trauma happening recurrently and you've never been part of it, it tends to become normalized. You don't really feel the effect so much until it happens to you. When it happens, when something keeps happening, it becomes like background noise. Yeah, same of same. It doesn't even make news. You just read it one corner of the newspaper or, on TV, and maybe it's now a line across and not something majorly. Oh, so 100 of people were 5 minutes? Okay, so I have to go a bit faster. All right, so there's something like financial trauma. And it's not a medical term, but it's used to refer to emotional and psychological distress that is caused by negative financial experiences that significantly impact a person's well-being. So for instance, a husband is able to has been able to provide for his family for years, and then suddenly wakes up, fuel is now 1,000 something, dollar and naira exchange rate is doing what it's doing, and realizes that I can't provide for my family anymore. That's event in itself makes him see himself differently from somebody who is capable and competent and a provider to someone who is vulnerable and not as strong as he thinks he is, something like that. Okay, so I'll go a bit faster. So how do people respond to trauma? What really happens in our minds when this thing occurs, this catastrophic event? There are 5 ways that people can respond to trauma. And I want to draw attention to the fact that these responses are automatic. They are instinctive. They go way down to being primitive responses, reflexes. And I'm pointing that out because I've had people, come out of a traumatic events and say, I should have done this. Why did I freeze? Why didn't I fight more? Why did I just flop like that? People being sexually abused. Why didn't I kick him? I should have done this. And I'm like, it's your frontal cortex, your prefrontal cortex was not working that time. I'll explain later about how the brain reacts when we're traumatized. The truth is, when we're traumatized, the amygdala takes over. The amygdala is a part of our brain that handles emotions, fear, anger, and responds automatically, sending neurotransmitter chemical messengers to different parts of our brain, to the frontal lobe, to the hippocampus, giving it orders purely on reflex. So this idea of it was my fault, why didn't I do this? You are saying that now, if I'm talking to a patient, because you are now a bit calm and your logical mind is now, balanced. But at that time, you were not responsible. You were acting automatically. So 5 responses. It's either fight, freeze, fawn, flop, or flight. So I was talking about the brain area. So the amygdala is, hyperactive. Emotion is everywhere, difficult to regulate. The hippocampus functions less. The prefrontal cortex that is responsible for our judgment, our decisions, executive function is low. So what we have, and the hypothalamus is also active. So we have increased heart rate, increased respiratory rate, decreased appetite, poor sleep. That is what you get because the part of your brain that is functioning now is beyond your voluntary control. So there's something called trauma responses could be immediate, they could be delayed. Someone may be fine in the interim. I'm okay, I'm good. Do you need help? No, I'm fine. Are you okay? I'm eating well. And this in itself, this delayed response is also the mind's attempt to hold it together, to keep us safe until, safety can be assured, then the person falls apart. So trauma responses can happen immediately when the person is confused or aggressive or collapses or freezes and is unable to, move, or it can happen sometime later. Trauma bonding is a phenomenon that was discovered, especially in people in long-term captivity, like the Chibok girls, for instance, where there is now an emotional bond between the person that is the victim and the perpetrator. And that happens because the perpetrator, like the kidnapper, is now the source of is now helping to meet the emotional need of the victim. And so the victim feels a sense of gratitude, especially or in physical abuse, when the victim is not beaten or anything, the victim feels a sense of, oh, thank you for not beating me. Oh, it was my fault that you beat me the last time. And then some kind of bond develops. And you must have heard some people marry their abusers later on, but that in itself is actually it's not healthy. It's not a healthy response, but it does happen. Other responses to trauma, shock and disbelief, that can last for hours, it can last for weeks, where people are still in a state of disbelief, they're still in a daze, intense fear. So even when people are out of the vicinity of the trauma, they are still afraid. Again, it's because of the hyperactivity of the amygdala. It takes a while to calm down. So they wake up suddenly in the night and they think they're still there again, and then they have to realize, okay, I'm at home now, I have to calm down. And then this fear can actually be generalized. For instance, if someone was a victim of one chance, and like, okay, I'm not going to take cabs anymore. And then they're like, oh, okay, it can actually happen in a Keke Napep. I'm not going to take Keke Napep either. Even Okada can carry me off. I'm not going to go anywhere. So it can start from one area and generalize it to other areas where you now find trauma being responsible for somebody not even wanting to move around again, and the person is just at home because for fear of being hurt again. Confusion is another thing that can happen. Exhaustion, when the person just feels physically tired, just not being able to move physically and mentally. Sadness, irritability, social withdrawal, being easily startled, where you can hear a noise and the person is startled. The bottom line is all these responses are just the brain's attempt to keep the person safe in the meantime, in the interim. Other responses. I'm out of time, aren't I? Okay, so I'm going to try and be a bit fast. So these are other responses. Somatization is one of them. People can feel like there's a heaviness in their pain, heaviness in their chest pain, or headaches, or lump in the throat. All these sensations, you can do the chest x-ray, you can do the endoscopy, you can do the barium swallow. For the medical people, you won't find anything. It's a physical manifestation of a psychological trauma. Other responses to trauma: hypervigilance, forgetting parts of the experience. So this is particularly important for the medical people. There are people who would want to set someone up and say, oh, he or she raped me, and then some people do that and it's completely false. One telltale way to tell, someone who is making up stories from someone who genuinely was assaulted is the ease with which they tell the story. Because of the response, I told you hippocampus is reduced. Hippocampus is responsible for memory and learning. Because the hippocampus is dampened by the hyperactive amygdala. So bits and pieces of the experience is gone. And as the person recovers in therapy, with medication, then they begin to remember. I had a patient who was raped severally, and for the life of her, she couldn't remember the face of the person. And then I would say, can you describe? She said, I can remember from the head up, but I can't remember what he looks like. So that is not conscious, it's unconscious because of what I've explained. So if someone is faking it, all the details will be easily recalled, but someone who was truly traumatized might not remember even very important details that you feel would be important because of the trauma response I've explained. Sexual problems. I once had a patient who I didn't know. I was seeing the patient as a medical person, not as a therapist. And I just said, okay, expose your chest. I'd like to examine you. And as I wanted to touch her, she just cringed. Then she jumped up. I said, are you okay? She said, no, I'm not. So when we sat down, I said, you were raped, weren't you? She started to cry. So haphephobia is fear of being touched, common in people who have been assaulted sexually. So beyond these short-term, responses, people can actually go on after trauma to have more long-term responses, and then they even meet criteria for certain disorders. Talk about the acute stress disorder, PTSD. Truly, it's not everyone who is traumatized that will have any of these. Actually, it's actually a minority, 3 to 10%. On average, 5.6% will have PTSD and even acute stress disorder. So they need to meet criteria for maybe having intrusion phenomena where they have nightmares, flashbacks, intrusive because the person might be doing something completely unrelated, having fun, laughing, and then suddenly it comes into their mind unbidden, without, not unwanted, and then they feel like they are back to that situation again, and the feeling, sometimes the smell, sometimes the sensation comes back. So this phenomena is particularly distressing because people feel like, am I losing my mind or what? This thing happened 4 years ago. Why does the picture keep coming into my mind? So yeah, these are some of the criteria that need to be met. Intrusive criteria, avoidance. They don't want to go near the place the trauma happened. They don't want to talk about it. They don't even want to see the picture, and even with trauma like losing a loved one, for instance, suddenly or in a terrible situation, it might even be difficult to look at pictures where you find the patient not being able to go through their phone and look at pictures of the loved one because it's painful. That's part of the criteria for PTSD. Okay, so I need to rush. Physical responses, all this heaviness of chest, rapid heart rate, muscle tremors, fatigue. So this is important for the medical doctors amongst us because, people think and when patients have these symptoms, they don't even relate them to the trauma they have. So I have malaria, I'm just tired. I just don't feel like doing anything, and then they treat malaria, there's no malaria, and they don't realize that it's the trauma they experienced and they thought they had gotten over it, but they're still feeling the effects to date. So just something for us to bear in mind. Some of the physical symptoms that might look like, they are physical symptoms somatizing, but they have psychological causes. So trauma changes us. That's what this presentation is all about. It changes the way we think about ourselves, about the world. So these are the different levels of beliefs. I've said this so many times, if you've ever listened to me, this particular slide comes up over and over again. So we have the very deeply held beliefs, which are called core. They are fundamental because they are like the basic way we see ourselves. Then we have the intermediate beliefs that are not so closely held on to. Then we have the automatic thoughts, and then we have the emotions, physiological behaviors, and coping strategies. So someone can start off thinking the world is a safe place. Nigeria is, insecurity, but I'm good. And then this happens and they feel like anything can happen at any time. In fact, that statement is one I've heard at different times from different people who have been traumatized. For the person controlling the slides, I'm at beliefs and trauma. I've gone past this. So they go to feeling like the world that I thought was safe is uncertain and it's dangerous. And they go from thinking, I am a strong person, I can take care of myself, to I'm unsafe, I'm not as strong as I thought I was. So for a lot of people, seeing themselves this way, different from how they used to see themselves, is actually what is responsible for a lot of distress that they feel. Because from the belief chart that you saw, where you saw that core beliefs, intermediate beliefs, thoughts, and then reactions, it is what we think that determines how we feel. So if I'm thinking I'm not safe, anyone can harm me, this world is not a safe place, I'm vulnerable, I'm not as strong as I thought I was, I am going to be easily startled, I'm going to be hyper vigilant, I'm going to be easily, irritable, I'm always going to be on my guard, I'm going to meet criteria for maybe, generalized anxiety disorder or things like that. So this is the understanding I want us to have. The reason why the person feels so emotional is because of all these thoughts, in addition to what I said about the amygdala. So everything is working together. But from a point of view of CBT, cognitive behavioral therapy, the strength of CBT lies in being able to look at these thoughts and find out whether it's realistic or not. If it is realistic, then we're going to talk about acceptance and what we can do in terms of problem solving. Right, so some errors in thinking, happen as a result of trauma, where people go from seeing things a bit more realistically to seeing things extremely negatively. So all of these thoughts that are listed here are from patients I have seen. So they're not from the internet, they're not off the top of my head. So all men are monsters. This is from a patient of mine who had PTSD from domestic abuse. So she had left the man at the time I was seeing her. So she went from feeling like, I love my husband, to thinking all men are monsters. So you can understand how difficult it was for her to be involved in any other relationship when she's thinking all men are monsters. It was difficult, but she wanted to, but she couldn't because she was always on her guard, she was always on high alert in close proximity with a man. I can't trust anyone. The world is a dangerous place. If it happened once, it can happen again. Bad things will always happen to me. I must be on guard at all times. So these are recurrent thoughts I hear from patients who have been through one kind of trauma or the other. So the strength of CBT lies in identifying these as errors and helping the patient to, formulate more realistic ideas. This is what reduces the symptomatology. This is what reduces the stress and that hypervigilance and that being easily startled and that, irritability. When they realize that, okay, all men actually are not monsters. I know my father is not a monster, for instance, or my brothers are not monsters. So if my brothers are not monsters, my father is not a monster, that means there's something wrong with the man who did this to me. It's not everybody. And that idea that everybody is a monster is an overgeneralization. So when they're able to identify that this in itself is an error, that is the beginning of healing. Information processing theory, that's where I am now. So this is just to explain what the mind does to this trauma event. I mentioned it earlier where I said the reason why trauma affects us the way it does is that the mind doesn't know what to do with it. And this is what gives rise to the sense of, I don't know what to do. I've never experienced this before. So, and the problem with this, why this is a problem, is that processing and integrating is crucial to healing. So when you have an idea or an event that cannot be placed in, we don't know what to do with this, we don't have any precedents for this, then this is the reason, the theoretical basis behind flashbacks. It's like when a cow or an animal is regurgitating, you swallow it, you bring it back up to chew again. So flashbacks are actually the mind's attempt to know, where am I going to put this thing that happened to me? So that sudden remembrance or sudden feeling as if everything is happening again, not only the picture in your mind, but the feeling, the emotion, the sensation, even the smell of it, is the body, the mind trying to see what to do with this. And the way out is exposure and the CBT. So the CBT helps the patient to come to terms with what has happened, to, instead of avoiding it, which is typical of traumatic experiences. If it's scary, if it makes you feel uncomfortable, then avoid it. Just don't think about it. Forget about it. But it is the avoiding that does not allow processing and integration to take place. So theoretically, this is the theory that explains why flashbacks happen. Okay. Before I go into what to do, we talked about trauma, what it is, what the types are. Let me just explain, what the body does or what the mind does with these thoughts. It's a process called either accommodation or assimilation. So accommodation means the conclusion that the mind makes as a result of the experience can either adjust the thinking that the person had before or completely throw away the previous one and replace it completely. So if, for instance, I thought that if a patient was abused as a child and sees other children and says, oh, fathers love their children. Assimilation, an example of assimilation would be, if fathers love their children and my father doesn't love me, then there must be something wrong with me. So it's been changed to accommodate the experience of the father abusing the child. That's an example of assimilation, the changing of a pre-existing thought to incorporate the event that happened. Accommodation is where you go from fathers love their children to all fathers are terrible. So you throw away the initial one and then you have a completely different belief. So just thought to mention that. Right, so now we can deal with what to do about the trauma. How are we going to handle this trauma? So there's a lot we can do in the acute phase. So if you have a patient who just experienced trauma, or maybe you are right there when it happened, you know, bomb blasts, the days of bomb blasts when we're still doing residency and people rushed and then people were confused and disoriented. At that time, what you need is distress tolerance, because at that time, the things people are doing is an impulse. They are reacting impulsively. And this is the same thing that happens with suicide, I might add, where people are so emotionally or intensely distressed and pained that their impulse is to get rid of this pain now. And the way out is, I want to leave this world. So that act is an impulse. But when they realize that you feel this way now, all emotions will go up and eventually come down, and there's actually something you can do about it, then the distress is a bit less. So all the things I've listed are things that do not require someone to think. We've not even gotten to the cognitive technique of reframing their thoughts, checking it, is it true, is it realistic? No. Because at this point, at this initial phase, the way the person is feeling, you cannot assess their logical mind. They are so emotionally distressed. So you talk about using things like temperature. I've mentioned this before when I was talking about handling intensely painful emotions. This is a time to get the cold water and say, you know what, just put this on your face. It actually does trigger the dive reflex. It does reduce heart rate. It does reduce respiratory rates and reduces hyperventilation. Then exercise is key. This is a time to say, let's go for a walk. Come with me. And then you're walking around. That movement will get the person to calm down. Paced breathing. I've had a patient rushed to my clinic. The head nurse would testify. She was hyperventilating when she came. And of course, I couldn't ask any question because she could barely even talk. So we had to say, take a deep breath, do the 4-7-8. And 4-7-8 means take a deep breath, hold it. That's count to 4 as you're taking the deep breath. Hold it while you're counting to 7 in your mind. And then exhale, counting to 8. When she did that recurrently, she was able to calm down and tell me what happened. So this is what you want to do at that initial phase. Progressive muscle relaxation is where you start with any muscle you like and progressively go up or come down, depending on which you choose. So you can start with, clench your fist for me as tight as you can for a few seconds, 5 seconds, and then relax. And then from clenching your fist, you clench your biceps, just, clench it, and then relax. And then you just go up gradually, muscle by muscle, clenching and relaxing. And the response at the end of the day is that the person feels more relaxed. Then this is actually the time that medications might be of use. But of course, this is short term now, because at this point, at most, this would be an acute stress reaction because it's barely, a day, 48 hours. It hasn't met criteria for anything because you need at least over 3 days to a month to make it acute stress disorder and over a month to make it PTSD. So this is when you might say, okay, you know what, take this for sleep, just to get you to sleep, because typically they wouldn't be able to sleep at this time. So this is what you do at the initial phase. You can use temperature, you can use exercise, you can use breathing, you can use progressive muscle relaxation. If you're a healthcare provider, you might want to do short course benzodiazepines. Short course, 3 days, 4 days, that's it. So beyond this, beyond the immediate phase, what do you do next? So the patient has slept for a few days and the patient is still, couldn't sleep very well despite your medications have finished, 3 or 4 days has finished. Then what do you do? This is the time to educate them on what has happened. This is the time to tell them that, you didn't do this, you didn't do that, it wasn't your fault because you were acting on instinct at that time. This is a time to bring to the fore the knowledge you have acquired by listening to me of how the mind deals with trauma, and to explain to the patient that the feeling you have of not being able to settle down, being afraid in your own room, is the aftermath of the trauma. It is because of what you have experienced. It's not because you are weak. It's not because you are not a strong man. It is a natural response. So when people have this understanding, I'm not losing my mind, especially if it has never happened to you before. This is the case with a lot of people. I've never felt this way. I've never not been able to control myself. Hearing that this is a natural response is very reassuring. So the education comes in now. The next step is what we're going to talk about now, which is accept. And this is counterintuitive because negative emotions, we don't want to accept. You want to avoid. You don't want to think about it. You don't want to remember. This is terrible. I want to, throw it behind the door, lock the door, throw away the key. But the problem with using so much psychic energy to avoid something is that you inadvertently confirm that that thing is serious for you to use so much energy to avoid it. And that idea in itself, that underlying belief, is what maintains the emotion. And this can be used with any kind of emotion. Maybe it's not as severe as trauma. Maybe it's something, less traumatizing, like a heartbreak. Oh, he has gotten over it. Why can't I stop thinking about this guy? I want to move on. And then I say, what do you do when thoughts of him come to your mind? Oh, I distract myself. I call my girls. We go out. We forget about him. I say, have you tried accepting it? What? I don't want to accept it. I want to forget him. Can you try it for a little bit and see how it goes? So what that means is when these feelings, these thoughts come to mind, rather than pushing them away, accept that it is natural for you to feel that way. Give the thought or the emotion room in your mind. It's like an uninvited relative that shows up at your house. You can't turn the patient away or the relative away. You're like, oh, come inside. Just stay in that room, and then you go upstairs. Pretend it's something like that. Put it on a shelf. This act of acceptance in this way is what reduces some of the suffering and recurrence. It even helps with flashbacks a little bit as well. So that's what I mean by acceptance. I'm not saying accept that you deserve for something to happen, or this is normal, or the way you feel is good, or steep yourself in it. I'm saying accept that it is normal for you to feel the way you feel, and make room for it in your mind and put it on a shelf. So what happens is this acceptance reduces the intensity of the emotion and makes you realize that this emotion I thought was going to unravel me is actually not that bad after all. I can handle it. So that's the first thing, acceptance. And then when you accept the emotion and the thoughts, what next? You can go in and out. So this is me describing mindfulness. So it's accept the emotion and be mindful. To be mindful means to accept the way you feel for some time, and then focus your mind on what is happening externally. So give yourself permission to accept it without blaming yourself or criticizing yourself, and then bring yourself back into the present. Refocus your attention from, the emotion to what is happening in the present. So you can refocus your mind either by using what we call grounding techniques, we'll talk about that later, or mindfulness of focus of attention, which is where you use your 5 senses to describe what you're seeing. And this is great for people who wake up in the night feeling that they are back in the kidnapper's den, or that the rapist is there again, and they are shaking and they're startled. So easy thing to do is look around. What can you see? My bedroom. Okay, what can you smell? Maybe my fragrance. What can you touch? The bed sheets. That grounds them and makes them realize that I'm at home now. I am safe now. I am no longer, in harm's way. So this helps them to cope with the way they are feeling. So I talked about acceptance. I talked about, part of acceptance, making room for it in your mind, realizing that it's not your fault. You are not weak for thinking this way, and then going back into reality. So it's a back and forth process. So it might look something like this. This happened, this trauma happened yesterday. It comes into your mind, you accept it. You are not fighting it. I don't want to think about it. No, you are in a position of, this is normal, this has happened to me. make room for it, and then you focus your mind on what you're doing on the external, using your 5 senses to ground yourself, and then you're going back and forth like that. So what that does is it reduces the intensity of the emotion over time. Next thing is not to blame or criticize yourself for feeling the way you're feeling, and then forgive. So forgiveness is particularly difficult. I don't even use that word flippantly. We say forgive, forgive, forgive. It is hard. It is very hard, because at the bottom of some of these emotions is resentment and bitterness and anger out at the effrontery and the boldness you had to do this to me. So there's something called loving kindness meditation. So this is a therapy thing now, but I'll just describe what it means. So loving kindness meditation is a situation where I have a patient close your eyes, and then I want have you to imagine someone you care about. Maybe a husband or a sister or God, anyone existing or not existing. It can be completely a figment of your imagination, but imagine the person vividly. So I say, can you see what the person is wearing? The person's eyes are closed, maybe lying on my couch or sitting, whatever makes them comfortable. What is the person wearing? Can you see the clothes they're wearing? Can you see the expression on their face? Can you smell their perfume? So everything I'm doing, harnessing the 5 senses, is to make it real as possible. So when the person has imagined this loving person in their mind's eye, then I will say, now imagine him or her giving you, sending you good wishes, wishing you well, praying for you, and receive all this goodwill and accept all this goodwill. Then we replace the loved person with this person that we're trying to get the patient to forgive. And then I say, take all that goodness in your heart and give it to this person. Not because they deserve it, but because you are who you are and you are a good person. So typically what happens when they're doing that, there's a lot of tears, there's a lot of, it's difficult, but at the end of the day, the person feels like they've let go, especially when the person who is the perpetrator did not ask for forgiveness. You don't even know the person is gone. But the anger and the resentment remains. So this is a way to let go of that bitterness and that resentment. So I've been talking about handling trauma after the immediate incident itself. Talked about accepting, being mindful, going in and out of the emotion, and forgiving, and not criticizing or blaming yourself. The next thing is to realize that this experience is a normal response to an abnormal situation. That was when I was explaining that this is a normal trauma response. You are not growing crazy. This is normal, and you will, with time, come out of it. Then another thing to do is to validate the emotions. Validate means to understand that it's completely understandable, or to think or realize that what you're facing is understandable and is expected given what you've experienced. So this is particularly helpful when the patient is thinking, I should have recovered from this by now. This happened, 2 years ago, but I still feel the way I felt, and it's as if it happened yesterday. So the validation means to tell yourself that it's okay to feel this way. It's because of how badly you are affected by this. So normalize means it's normal. Validate means it's understandable for you to feel the way you're feeling. Another thing to do is try distraction. How much time do I have? Sorry? 45 minutes? Okay, no, I'm going to be using that 45 minutes. We've entered the 45 minutes. Of the 45 minutes, how much do I have? The full 45 minutes? Oh, good, I have time. All right, so distraction is another thing. So distraction means anything that gives rise to good emotion. So this is the time to watch, the funny comedy, or go out and experience nature, or go see someone and talk about whatever you want to talk about. So the aim of this is to remove your mind from the pain. It's a distraction. Problem solving is where you ask yourself, what do I need? This incorporates self-compassion as well. So talking to yourself like you would a good friend. Some people are surprisingly very mean to themselves. Some people are their own worst critics. Some people talk to themselves, in a way they wouldn't talk to their friends. They tell themselves, come on, what's wrong with you? Are you weak? Are you stupid? Get over this. You're a man or you're a woman. You're a strong person. So self-compassion means talk to yourself in the way you would talk to a dear friend, and encourage yourself that way. And then ask yourself, what do you need? Oh, I need to get out of this place. Okay, go for a walk. Oh, I need a hug. You can actually hug yourself. You don't need someone to hug you. You can actually just hold yourself. Do something soothing. I'm going a little bit to self-soothing now, but I'll talk more about it when we get there. So these techniques I've talked about. This is another way that you can handle, the trauma after the event itself. Express yourself is huge. Now, I don't just mean talking about it. Some people are not big talkers. Some people communicate with lyrics. If there's a word of a song that expresses your emotion, go for it. If it's painting, fantastic. If it's journaling, fantastic. If it's prayer, excellent. But bring it out. The reason is that expressing, helps the processing, helps integration, and helps healing. But not talking about it, avoiding it, delays the healing and prolongs the disorder. Okay. Other techniques, grounding technique, I mentioned it earlier, and that is when you use your 5 senses, to describe what you're feeling, what you're hearing, what you can taste, what you can feel, to bring yourself back to the present, especially in people who have flashbacks or who feel like they're back in the traumatic experience again. Grounding technique is especially helpful for those kind of people. Self-soothing is where, especially when there is sadness and that feeling of vulnerability, self-soothing is still using your 5 senses in the service of helping yourself feel better. What will I see that will make me feel better? Oh, there's this person I care about. Seeing their picture makes me happy. Watching a funny movie makes me happy. Listening to soothing music is nice. Listening to the Word of God, maybe some podcast, is fantastic. Inhaling scented candles works fine. Having a bath with warm, so I'm talking about all the senses, your sense of sight, your sense of hearing, your sense of taste, your sense of touch, using all of them to help yourself feel better, using any of these senses in the service of your feeling better. So that's to self-soothe. So this is great because if you're alone and there's no one to tell you, come, it'll be okay, you can do the same just for yourself. Self-compassion, I've mentioned it already, in how you talk to yourself compassionately and how you help yourself as well. So what do I need? What will make me feel better? If I had a bowl of pepper soup, I think I'll feel better. And if you can afford it, fine. Then act in opposition. So to act in opposition is a direct way to handle emotions, especially one of sadness. So if you were here for the talk on emotional or intensely painful emotions, I said that every emotion has a behavioral, hook to it, urging us to do something in response to the emotion. So sadness typically wants us to withdraw and stay by ourselves and think about what happened, think about it over and over again. So acting in opposition is going against that urge, that emotional urge, and doing exactly the opposite, regardless of what you're feeling. So if you're feeling like just being by yourself because you're sad, acting in opposition would mean call up a friend, can we go out? So what happens is behavior also affects emotion. So when you are acting in this way, before you know it, you are less sad, hopefully a little bit happy, and you have some sense of control over the emotion, unlike, well, I'm sad, I just feel sad, I don't know what to do. So this is something to do, to act in opposition. So every emotion, rather than doing what the emotion is urging you and drawing you to do the opposite. Handling trauma. Spirituality, I mentioned prayer, I mentioned meditation. For people who are spiritual, very, very useful. Visualize yourself coping. Visualize yourself coping means to imagine yourself. So the thing with thoughts, I mentioned that thoughts give rise to emotions, give rise to behavior, right? So there are some people who think in pictures. And typically thinking in pictures gives rise to very intense emotions that are more intense than the thoughts would give when people think in words. So if it's a picture that you're thinking in, and you have the picture of yourself, maybe talking about trauma, maybe cowering. I had a patient who said she saw herself, sitting very subdued, very tame, and then her perpetrator hovering over her and shouting, and she was cowering, in the background. We can actually do something called rescripting. We do the same thing for nightmares when it comes to PTSD. You can actually rescript it, where you have the picture of someone cowering, you cowering, and the person towering over you. You can make it comical. You can make it that you are now the one that is strong, and the person, now that you've recovered, that was you back then, but this person is not that person. And you can you could resculpt that picture and have you be the powerful one, and have the person be the one that is in trouble, or bring in someone, a nurturing figure to help you. So patients don't need to be at the mercy of images torturing them, we can do something about them. And if it is a nightmare, we can also rescript the nightmare and have them read it over and over again. I'm not talking about things that we've tried, I'm talking about things that is supported by evidence to help, especially people who have PTSD as a result of trauma. There is something we can do about that. So talking about visualizing, but what I just talked about, I went into resculpturing imagery. What I meant to say was visualizing yourself coping, which is see yourself coming out of this better version of yourself by the grace of God. So the spirituality is there. Social support is, very helpful. Allow yourself to be helped by people, if you have people around you. Use the mindfulness we talked about earlier, where you are accepting the emotion and then bringing yourself into the present to engage with people and not just being yourself. Checking the facts is crucial, but a lot of times, you need to be guided by a therapist where, remember when I talked about the thoughts? And I said the thinking of people who have been traumatized has been changed, either adjusted or completely turned upside down. So this is where therapy helps, where we're looking at, is it true, for instance, that, the world is completely unsafe? Well, actually, Nigeria is not safe as a fact. So we could look at what could you do to keep yourself safe, different from maybe what you did before. So that is where therapy comes in, and we're trying to be realistic. We're trying to, ask questions of, what is a better thing to do than this, and actually come out with a plan of what you could do if you ever found yourself in this kind of situation next time. Remembering your values. So this is important because a lot of times people that have been traumatized, it's like the rug has been pulled out from under their feet. So their world is turned upside down. So they're trying to find an anchor. So this is where values come in. What do you care about? A lot of people care about other people. So doing kind things for other people, even when you're hurting, makes you feel better. Whatever it is that is important to you, this is the time to work on it. For mothers, I always bring in their children. So this has happened to you, right? But these children need you. So using that mindfulness of acceptance, being aware of my environment, and then bringing in what they care about, the children, what could you do for your kids, at this time? So when they are in the moment, in the present, away from their thoughts, they're able to take care of their kids, and this helps them feel better. Otherwise, they are just trapped in their thoughts, and kids are neglected, and it can go downhill from there. Maintain structure and routine is hugely important. What you used to do before, just keep doing it, even though you don't feel like it. The reason you should keep doing it is that behavior affects emotion. After some time, the intensity of the sadness reduces. So, to reduce vulnerability, let's say this has happened and the person has recovered, but they were so shaken by what they went through that they don't ever want to feel vulnerable like that again. They don't ever want to go through that feeling again. Then we can use ABC, please. That is an acronym that stands for, the A is accumulate positive emotions. So you can have a bank of positive emotions. And this is also great for relationships. You can store positive emotions. So what happens is that the more you have in your bank, when stressful events come, you are better able to ride them than when your bank is in red and you are barely managing to get through, and then negative emotions or negative situations can just throw you off balance. So accumulating positive emotions, keeping in positive emotions in your bank, so to speak, is fix it in your schedule, in your daily routine, things that make you happy, things that give you pleasure, things that give you happiness, anything that gives pleasure or a sense of mastery. Let it not just be something you are doing, once off. And it doesn't even have to be expensive. Let it be part of your daily life, something that is fun and gives a sense of achievement. Build masteries to engage specifically in what gives a sense of achievement. Personal development is important for some people. Do something that is in line with what you care about that gives a sense of achievement. Cope ahead. So typically for people who've been through trauma, around that time of the year, or if they are going around back to that place where it happens, there will always be like, it comes back again. The emotions come back again. The pain is like an open wound. It comes back again. So don't just wait for it to happen, especially if you must go there and you must interact with this person, maybe in a law court, you have to testify and you're like, I don't want to see this guy. You can cope ahead. What that means is, what are the things you envisage will go wrong? And what could you do to prevent them? So you are preparing yourself and making sure that you have solutions for the possible problems that may come about, that may develop. So that's what it means to cope ahead. Other things are, taking care of yourself, treating physical illness. If you're physically unwell, And this is especially to people who have chronic illnesses. Having a chronic illness, hypertension, diabetes, that has been forgotten because you've been so, traumatized, so to speak. Remember that if you're not physically well, emotionally, it will affect you emotionally and vice versa. So take care of yourself physically. Exercise, so not just as a way of handling the distress of the trauma, but actually as a way to keep your body strong, as a way to make sure that you prepare yourself, reduce the risk of vulnerability. Avoid substances. So this is easy to say, but it is very tempting when you are in this position to reach for something that will help you to sleep, to reach for a substance that you know will help you relax. So substances like the weed come in, the codeine come in, the cough syrups come in. If you've had a run-in with addiction before, this is a time when relapses happen. So it's very easy and very tempting to be drawn into to use something to help yourself feel better, because the skills I've described, they need practice. So this is a time, and for the medical doctors in the house, this is the time to also screen for substance abuse, because trauma can lead people to using substances, as it can also lead to suicide. Good sleep. So easier said than done. There's something called sleep hygiene, where you sleep around the same time every day. You have a particular set of activities you do around the time that you want to sleep to make sure that you are informing your brain that we are trying to wind down now, we are trying to calm down. So doing those activities in the same order every time increases the likelihood that you're going to sleep. And more things like this to ensure that you have a good sleep in the aftermath of trauma. Balanced diet. So the point I'm trying to make is that handling trauma is beyond only psychological techniques. Taking care of your physical body is huge as well. And that is also what I was trying to say when I said maintain a routine. Take care of yourself, have a bath, brush your teeth, comb your hair, do your hair, which are things that are easy to overlook and you just let yourself slide. But doing those things will actually improve your mood. Tips for family members. So question I hear is, what can I do to make it better? How can I help him or her? Think mothers with their children, or loved ones, or wives and husbands, and vice versa. The most important thing to do is just be present. Let the person know you are there. You don't have to have any, great response to what they have to say. They are going to be saying a lot of things. Be present, validate what they're saying, empathize with them. You might never have experienced what they've experienced, but just being there is very helpful. And don't pressure them to talk or say it. I know I said expression is helpful, but some people, the rate at which people process their trauma is different. Some people don't want to talk at that time, and it's fine. If they don't want to talk, let them be. Some people, like I said, remember I said some people prefer to write things down. Some people prefer to journal. Some people don't want to talk. So if the person doesn't want to talk, it's fine. You don't need to pressure them to talk. And if you don't have any useful thing to say, it's better to just not say anything. Something as simple as, I'm here, I'm not going anywhere, what do you need, what can I help you with, is helpful. Rather than saying things like, be strong, or you'll be fine, or you'll be okay, and those kind of things just make it clear that you really don't understand what the person is going through. So when I say listen actively, if they want to talk, validate. Validate means what you're saying is, perfectly understandable given what you've experienced. Empathize means I can see how much this has hurt you. I can't imagine what you're going through right now. And facilitate means show by your behavior and your words that I'm here, I'm listening to you, I hear you. You can nod your head. If it's appropriate, you can touch the person. Offer practical support. For the women, this is the time when the household is upside down. They don't remember to cook. They don't remember to do anything. So if you want to help, this is the time to tidy up the house, bring food, and things like that. So I've talked about what you can do to help yourself. When is it that time when you say or you feel like, okay, I've done everything I learned in that lecture to do. I'm not still okay. When should you seek help? This depends on the duration. 3 things: the duration, the level of distress, and how much it has affected your function. If it's lasting more than 1 month and you're still not getting better, so usually what happens is the person is intensely distressed and then it just begins to reduce in intensity. So if there's no reduction at all, it's as intense as it was when it started, then even if it's not up to 1 month, you should probably seek help. But if you notice that with time, sleep is a bit better now, I'm not as sad as I was before, I'm not as scared as I was before, then you can wait for 1 month. If not, then you probably should get help before that 1 month. the intensity of your distress, we know it's significant when it's affecting your social occupational function. That is your relationship with close people. When, I mentioned in PTSD about the numbing, when people don't feel anything for people they know in their head that they care about. When you have those kind of, symptoms, then it's time to seek help. Some people describe something, we call it spacing out, zoning out, when they're trying their hardest to be present, but then they just realize that for some seconds they really didn't know what that person said. And this is dissociation. Again, it's a response to protect you from what is happening, and also the mind is trying to figure out what has happened, to try and place what has happened in a file, when I use that filing cabinet as an example. So this is what you see in people with PTSD, for instance, times when they are not present and they just space out. And then some people actually dissociate to the point where it goes into derealization or depersonalization, where it's as if they're out of their body and looking at themselves. It's like they're watching themselves going through their life. When you have those kind of symptoms, then you probably should get help. When it's affecting your function, you can't function at home, you can't function at work, you're not the person you used to be, then you should get help. So when you get help, this is what we will be talking about. We'll be doing psychoeducation, the restructuring of your thoughts. I said make it more realistic, from all men are monsters, identifying this as overgeneralization, to making it more realistic. Emotional regulation, the acronym is what I use to remind myself of what I need to do to help patients who are emotionally dysregulated. Exposure therapy is actually the gold standard for treating people that have PTSD. And the reason it works so well is because they are trying to avoid. But what we will do is, in the imagination, we'll expose them to the thing they're trying to avoid. And by the time you do it repeatedly, so typically what will happen is there's a lot of fear, there's a lot of crying, there's a lot of pain. But the more you keep going through this memory over and over again, the intensity of the fear keeps reducing until it becomes boring and they're not avoiding anymore. And then the symptoms begin to lift. So that is the gold standard treatment. Other treatments are also there. And medications, SSRIs, selective serotonin reuptake inhibitors for the medical people, are actually helpful in treatment of PTSD. Okay, so the silver lining is that there is something called post-trauma growth. For people who go through this terrible occurrence, terrible event, they come out with increased resilience. They come out with an increased recognition of the value of life and relationships, which deepens and strengthens their relationships. And they come out with more, better purpose, and they are more focused in their life. Revised priorities, deepened spiritual fervor. So that's the silver lining to all these terrible things we've been talking about. Thank you.